Hey everybody, this episode is an interview with Dr. Amanda Fisher, who is a core and pelvic floor expert, a menopause expert, premenopausal expert. She is gonna break down all of your pressing questions when it comes to this area, an unstudied area, a very minimally researched area, something people don't like to talk a lot about. Stick around because we're gonna go deep. I'm very curious. I ask her a ton of questions that are gonna be exactly the answers you need to get when it comes to your core and pelvic floor. Not only a Burn Bootcamp brand champion, but also a member at Lee's Summit, Missouri. Welcome to the podcast, Dr. Amanda Fisher. Welcome to the Burn Podcast, where strength meets science, food fuels energy, and mindset creates momentum. I'm DK, your personal trainer, and I want you to train, eat, and think differently. So get ready to take your health and fitness to the next level here on the Burn Podcast. Let's get to work. Okay, all right. We are rolling, by the way. How's your legs feel after that workout?
Like Jello.
Like Jello? Yeah. Well,
I don't think I could have gotten up off the toilet here. Like, give me an hour. I probably can't even get out of this chair.
Well, I think we wove in some core and pelvic floor exercise, or at least some marketing during our Burn on Demand session today, as I'm taking you and the studio crew through leg day. It's a special day. Thanks for coming in. I'm glad that you're here. We have Amanda here, everybody, and Amanda is, as you already know, most of you know, you've listened to her core and pelvic floor series on Burn on Demand. You've done a lot on Burn on Demand. Why don't you tell everybody what we've done at Burn on Demand, what it's meant to you? Maybe just give a little bit of your background so people that haven't heard of you before or haven't come across you in Burn Nation can get to know you a little bit, and then we'll talk about your little toy.
My little pelvis.
You got a little, but we want to. Before you do that, I just want to tell everybody, ladies and gentlemen, what we're going to do today is we are going to educate ourselves. Okay, we're going to educate ourselves on the pelvis and what to do to strengthen your core, strengthen your pelvic floor. We're going to talk about perimenopause. We're going to talk about menopause a little bit. And I'm like the most uneducated person in the room on this stuff. So we have the expert, Amanda Fisher, here to really break us down. Okay, makes sense? Say yes?
Yes.
You guys ready to go?
Yeah.
All right. So why don't you just start with your background?
All right. I'm a pelvic floor physical therapist out in Kansas City, Missouri. Woo! I do in-person work as well as virtual. I love the virtual world. Started doing that, working with people virtually, 2018, 2019.
Well, it makes sense too, because we have Burn Nation members all over the place that can come hang out with you.
Which has been really fun since doing the Burn on Demand stuff. First series was core and pelvic floor, and really walking through different protocols and how to connect the pelvic floor and core with leg day, arm day, athletic conditioning day. And then we've evolved into postpartum, which was really fun, and really hitting the women at home for shorter amounts of time than the 45-minute camp time. So they're probably closer to 20-minute camps on Burn on Demand, but lots of cues on how to connect to the pelvic floor, how to connect to the lower abdomen. I've had lots of women stop me at our home gym in Lee's Summit, Missouri, saying I have felt my core more going through those short videos on there. And thank you for the reminders that I can then take back into camp. So that's been awesome. And we did the Perimenopause Menopause series as well, which is, that was a lot. That was fun.
What reminders do you hear people most often recalling that you've talked about?
I've said tits over toes.
Tits over toes?
Yes. There's a trainer named Kayla out in California that she'll quote me with that, and she'll always tag me with that when she's telling her people online.
Well, it's a catchy one. I can see how that will.
Yeah. And it's all about connecting. Like, you move, a lot of women tend to like bring up their chest, which then lengthens out their core, similar to pregnancy, how we're stretching things out. And women kind of stay that way during, postpartum phases and then continuing on in life. And if we can remind them to kind of stack the ribs over top of the pelvis, and right before we go run, or right before we start that movement, or before we start to jump rope, we move kind of into that tits over toes position to activate the lower core and front abdomen. And that's a little cue that has kind of
Did you do that today during the on-demand workout as we're getting started? Do you remind yourself of that, or is it just natural?
Yeah, I think during the mic'd up, I was like, tits over toes. And then you were like, don't let your chest go over your toes. I was like, tits over my back toe. Keep this one here, but don't lean over this one. No, yeah, I do it a lot to myself, especially if I even notice myself feeling urgency, like I'm going to go pee my pants during like jump squats, if that was the exercise.
That's like the most notable thing, by the way, that every member tells me is like, DK, do I have to jump rope today?
Yeah.
I'm going to pee my pants if I do. Yeah. I know what that means. Do I have to jump rope today? I know what that means.
And a really quick fix is just fixing your posture. Look at your form. did I get a little slack on that? Where can I just adjust myself? Oh yeah, now it's connecting again, and maybe I don't have to go rush off to the bathroom. I can get some more reps in, or it starts to build up that endurance much nicer and keeps it talking.
Okay, so take me through the visual. I'm a member. I'm at a 9:30 a.m. camp. I'm jumping rope. I got a little pee-pee, a little tinkle.
Yep.
What do you and I'm somebody who has this. Usually you're going to just be like, okay, I got to shut that exercise down, but you don't do that. You say, go inward, think about the mind muscle, the mind body connection. What do you think? How do you get yourself outside of tits over toes? How do you, it's funny for me to say that one. I don't know why, maybe because I'm a guy. But how do you walk people through that visual of, hey, don't run off to the bathroom, like fix it now. The fact that you actually have to pee is a sign that you can fix it right now.
Yeah. So as they're doing the exercise, I will watch them and their chest slowly starts to come up and back and lengthens out. So you want to think about keeping the ribs stacked over the pelvis or keeping the girls on a shelf. If you've got a great bra on, the girls are going to stay on the shelf. They're going to face forward. You start to lean forward just a little bit. You're not like leaning off the edge.
Okay.
It's just a little, maybe less than an inch.
Tits over toes.
Forward. Right.
Got it.
And that helps to engage, gets the muscles talking together again. So we're not using our back now. We're not stretched out core using our back to jump.
Yeah.
We're actually going to use the core.
That makes sense. So how do I get in a position where I need to come see you in the first place? Like what naturally happens to people? Men, start with women because it's more prevalent in women, but you had said off air that you're starting to notice some men that are coming in and see as well.
Yeah. Typically, I feel like for both parties, it's taking way longer than it should. Like, it's not like knee pain or back pain where people are like, have dealt with it and they're like, oh, that's pain. Pain means I need to go see a doctor to get a referral to physical therapy. The bladder leakage, I feel like people push through more and they're like, oh, okay, well, I'll do it again next week and I'll see how it goes. Or I'll just stop doing that exercise or I'll modify, but they're still peeing their pants with that activity. Oh, I'll just stop jumping on the trampoline with my kids. Or I feel pressure with this activity. I'll just do it until I don't feel pressure again. So I feel like a lot of the symptoms when people have them, it's been, I consider like chronic. It's longer than 12 weeks when people finally come in, where I feel like is individuals, if we could start recognizing that that is also a sign of maybe broken form, poor in strength and conditioning, maybe we've pushed the load on it, that there's some breaking point. Like, can we fix it with posture first and form? If we can't, then let's go see a pelvic floor physical therapist or work with someone online to kind of help us work through how to build up that strength and stability to keep us going at camp.
So the reminders that you were talking about, and I remember this from our last podcast that you came on and did, and you talked about standing at your bathroom sink while you're, I think it was brushing your teeth.
Yeah.
And you're doing an exercise and you're squatting down and you're like contracting your perineum, which is the pelvic floor, or part of the pelvic floor. You have to educate me on this. But I know the perineum because when I meditate, Kundalini meditation is squeezing the perineum, which you're going to have to get me right on my anatomy here. But to me, it's like two little muscles that sit right underneath your butt. And you squeeze them together and it draws the energy and then you up to your belly button. And it's kind of like, I know this is not the topic that we're talking about today, but I'm kind of a yogi. So I have like this practice, Kundalini meditation, and I'm using the perineum pelvic floor to draw energy up. And it's the most important one in that practice. It's the most important muscle group because it's the practice says that's where we keep the majority of our unspoken stress. Is like down in that area. So
how many people do you think are trying to do that right now?
Oh, I don't think many. I don't.
While listening to this podcast.
I think people are like, what are you talking about? They're like flexing all their pee and poop muscles and seeing what goes on. But I think you need to dial it in for us because I don't think people, I don't even know what the perineum is. I just know that it's those two muscles and I can visualize what they do. But you might have to give me, what's your pelvis's name here?
This is Patricia.
Patricia. All right, everybody. If you're watching on YouTube, we have Patricia. We did not call this pelvis Pat or Patrick.
Patrick would have been nice to go. Right. Keep it in the KC family.
Okay, so
no, the perineum area is really this muscle that connects it left to right down here. So it's a transverse muscle, horizontal muscle. There's two of them. You're correct. That stack, one in the front, superficial, and one right behind that. those muscles, women will know because of the perineal area. We do perineal massage before we have babies to help lengthen out the tissue to decrease tearing. So people will do that. This is also the majority of tears or where tears may happen with vaginal birth. So that perineal area, you can connect to the pelvic floor, everything all together. You can connect front to back. You can connect left to right, meet in the center as you lift, the way you're describing it. But those are the muscles. And as you were saying, like stress, I would say you are spot on. A lot of my patients that are coming in, even for pelvic pain or lower abdominal pain, they'll hold a lot of tension and stress in their pelvic floor.
And I've even seen people and I'm only relating this back to my personal experience with the Kundalini meditation because it involves the perineal? Tomato.
Yeah.
Okay. The perineal muscles. And part of the reason I think people won't jump to like, hey, I use that right away is because they don't know what it's called. They know that they feel something happening down there, but nobody really knows. It's not something we're very educated on. And so I'm happy that I came across meditation because it asks me to engage this muscle group. So I kind of know what it is. What type of, like when we're talking about the stress that, we hold in like the sacrum and in the pelvis, I've seen people do Kundalini meditation or any type of meditation that's activating that energy center, and they start crying. If they've never done it before, like I did it in a group in Tulum, Mexico.
Yeah.
We did this type of meditation in the jungle, and people start just crying because they've never activated this muscle before, and it's pushing that unsolved, mystery in their life or that unsolved energy up their body. It's crazy.
Yeah. I think there's so much to be said there because like even with clients, like I in person will do an internal pelvic floor assessment. So we can even hit areas in the pelvic floor manually where it'll send people crying. Or if we're having a conversation about something that maybe was traumatic in your life, your pelvic floor will tend to tense up and tighten up. And I can tell, okay, we either need to connect with a mental health therapist to work through this, or we need to talk through this a little bit more. Tell me about this scenario that I can feel that you're holding tension down here or holding emotion, and we can help our clients work through that. But a lot of times it's getting in contact with that mental health therapist too. But I mean, it could be trauma from childhood with like an alcoholic father, where maybe you as a kid was holding all that tension in and trying to keep the peace, at home while that was happening in your family. Or it could be even women coming in that have had miscarriages and they're holding that trauma in there too. So it's a wide variety.
So you mentioned the correlation to mental health and really, the way that I think of mental health is it's not necessarily, it's like some sickness, but rather a state, like a state that you're in. Yeah. Are you mentally unwell if you're toward guilt and shame in the lower spectrum of energy and negative emotion, and you're toward mental health if you're in joy, if you're in enlightenment, if you're in pride in a good sense of pride, not an egotistical sense of pride. How do you correlate maybe like the emotional position somebody is in with their pelvic floor? I mean, do you meet people often that have super good high energy, but a terrible pelvic floor? Or is there really an emotional correlation between the physical nature of the body? Because it seems to be a lot of it's interconnected. I'm interested to hear your perspective.
It is interconnected, but there will be people that have such strong, positive, energetic energy that come in, and their pelvic floor will be tight as a fist. Like if I could bounce a quarter off your pelvic floor, it would bounce right off. Okay. And I think for those individuals, because I was probably used to be one of those people where it's just like our day is so go, 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 and we jam pack everything in 24 hours, your pelvic floor doesn't have time to relax and go into that relaxation state. So I feel like their pelvic floor is always like this and high and tight. So we have to teach them, how do we start grounding? How do we add in meditation? How do we give the pelvic floor a break? Because no muscle is meant to contract 24/7, right? Yeah. And that's maybe how their pelvic floor is reacting to life, where on the outside, everything's great. But is it like, or do we have what's the reasoning to this jam-packed day where the therapist could help them dive in through that too?
Yeah, so you're saying that oftentimes, regardless of the emotional state that you're in, it can be something that is very sneaky, that just exists there and you don't really understand it until the first symptom comes along, which is not a pleasurable symptom.
Yes. And I would say this is probably me also taking into my own past into all of this too.
Yeah. Tell me how you got into it all.
I was in physical therapy school, I played sports my whole life, competitive sports, basketball, volleyball. I had planned to be sports med PT. I was athletic training for the Mizzou football team during college. Absolutely loved it. I thought I'd go into female sports. While in physical therapy school, I developed pain with intercourse and started peeing my pants at 21. I was running 6 half marathons a year. Not the smartest thing to do, but that was my stress reliever during college because, basketball, volleyball were gone. My past prior to that was a child of an alcoholic father, crazy, chaotic life in the home. You never know what type of environment you're walking into, right? So I think as a kid, I was probably holding all that stress from that, going into life, you start to build as much into your day. What can I control? And then that plays into a high tone pelvic floor as well. So I think it was just this beautiful storm kind of habits kind of created what I was going through and dealing with my own pelvic floor issues that then I wanted to help more people realize, like, don't feel guilty. You don't need to feel shame over this. You're not broken. There's a lot more out there that we can help you improve your symptoms too.
So this is very much correlated with breathing. There's a lot of breath work that goes along.
Yeah.
Chelsea, I want you to go ahead and just give people on GPT like the definition. Give us the best 3 breathing patterns for core and pelvic floor rehabilitation. Do you happen to know any ones that are?
I love 4-6 breathing.
Okay, let's talk about that.
So you breathe in for 4 seconds, out for 6 seconds. I even like to put the tongue on the roof of my mouth for some of those.
Why is it important to breathe? Because I've heard of this before, but for different applications, why is it more important to have a longer exhale than an inhale? Are you familiar?
It's for the nervous system, I believe, for the vagal nerve.
Yeah, I'm assuming it probably puts you in, like, Google this too, Chelsea.
Vibrates it.
Yeah, like your parasympathetic nerve system is activated once you are in like this relaxed mode, and the art of breathing longer out kind of tricks your body into being into this relaxed parasympathetic nervous system mode.
Yeah.
Okay. So 4-6 breathing. And if we demonstrate that, it's just 4 seconds in
for 4 and then out for 6. Exhaling out. I like to have my clients breathe into their ribs versus breathing into their belly.
Okay.
Because most clients that I see are breathing more into their upper chest naturally. And we have to work on really expanding out the rib cage to let that breath go into the belly without pushing the belly out. Because a lot of people want to push that belly out when they're breathing into it.
So like you're actually, when you say breathing with your ribs, what you're actually meaning is like imagining, what do you actually
imagine your ribs as you inhale are filling up like bucket handles kind of coming up on the side of a bucket. And then as you exhale, those bucket handles come back into the body. So that gets all our tissue 360, right? It's going to get into the back thoracic spine, into the rib cage, into the front abdomen. And then as you put your tongue on the roof of your mouth, you can even breathe in and out your nose with your tongue on the roof of your mouth. And it creates a nice little suction into it. So you can try that breathing in your nose and out your mouth, or in your nose, out your nose.
And so this is a kind of an elementary type breathing pattern for somebody to get into if they're just
starting
discovering this literally today.
Yeah.
One thing they can do is just start controlling their breathing. What mentally are you going through? Because you've been discussing the connection between the brain and the muscle, the muscular.
Honestly, in the beginning, I'm just having them focus on ribs.
Okay.
I don't want to get too technical. They'll overthink it. Yep. That's majority of my clients.
I like to get technical. Okay. We're going to get super nerdy.
I go very third grade level with my clients where I want them to just focus on the breathing. So their brain can just focus on one thing, shut that off. Otherwise it goes into that. Did I have the dishes in the sink? Did I forget to remove the laundry? Let's just focus on the breathing. I want 1 minute easy, and then we can start to build on that small goal. I don't like to give them big goals in the beginning. You accomplish that 1 minute of 4-6, great. Then we might try 2 minutes, and we might try 3 to work our way up.
Okay. Is breathing usually, if you were just to talk to somebody in the streets and you don't have time to sit down and you can kind of diagnose their life circumstances, that's kind of one of the things that you'd give to them as a gift for meeting you is like, hey, try this 4-6 breathing pattern.
I like that. And get yourself on the wall if you can in a butterfly position. Get your legs up on the wall, feet together, legs out, more in an adductor stretch.
Okay.
Put a pillow underneath your pelvis. It'll prop it up a little bit.
Okay.
Let gravity pull it into your abdomen, essentially. Helps with blood flow and circulation.
I got it. Is there a specific name for that pose?
Butterfly pose on the wall.
Can you look up butterfly pose on the wall? Your visual that you painted a picture for us was great, but I want to see if we can also pull.
I have a video on YouTube too.
You do have a video on YouTube?
Yeah.
See if you can find her video on YouTube. How long is it?
1 minute.
Okay, perfect. Let's say Amanda Fisher YouTube 1 minute. Is it what's the title of it?
It's a great question.
Okay.
It might be butterfly pose.
Perfect. Try that. We'll try that. We'll see if you can get a little content plug of your own stuff out here rather than going to somebody else.
Not either.
Okay, we'll let Chelsea look for that for a minute here.
I'm in a white shirt if that helps.
Okay, so every breath, essentially what I hear you saying can be, now it's not going to be all the time, but every breath can be a core exercise. And so tell me if I'm stretching this or not, because this is what I hear you saying.
Okay.
If I never focus on breathing, if I'm not conscious of my breathing, then there's a much higher likelihood that I'm going to develop core and pelvic floor issues over my lifetime. There's a higher likelihood if I'm not somebody who consciously understands how to control their breath, the neuromuscular connection. Is this true? Is this false? Is this a stretch? Because I feel like I probably need to just be more aware of it, and I'd have a better pelvic floor tolerance. But I could be wrong. You're the expert.
I don't know which one comes first, like the chicken or the egg on, like, are we more stressed and
Ooh, that's a great
question. Where I don't know if we become stressed and anxious and busy, where we just live in this more high tone, tight personality, or I don't know. Is
it more physical? Like, is it like if you were to take all of your cases and you were to say, hey, the reason I have these cases is because 87% of my cases were women in postpartum. And not too many of them are just like purely kind of emotionally or mentally driven. It's mostly because I went through some physical trauma. If I'm trying to explore this, I'm trying to figure out, well, hey, I got this little back thing and it's like, maybe I have like
that video right there. Go back up.
We got it?
Go down. Do you see the blue RDL? Go next to that.
To the right, it's called Challenge the Core.
Yeah.
Test yourself.
Shoot, nope.
Is that the one?
That's probably not.
All right, we're going to find it. No worries. We're going to find it here eventually. But yeah, like, so much of this is correlated to your breathing. If I'm somebody who's never conscious of my breathing, or I've never actually taken the time to stop and say, how does my breath connect with my body? Then chances are at the very least, I'm not as healthy as I could be with my core and pelvic floor because I've never synchronized it to my breath. Am I off on that? Or
no, like I would like to say the diaphragm is kind of like your light switch to the core.
Okay, I like that.
All right, so if you are not addressing the breathing, you're missing a puzzle piece. You've like skipped level 1 of Mario Brothers and you've moved on to level 2, and people try to do pelvic floor exercises for level 2, core exercises for level 3. Like you're missing a huge piece of the puzzle. So if it's the light switch, it helps kind of guide as you breathe in. Here we go. We'll use Patricia.
Let's use Patricia.
As you breathe in, that breath's going to go down into the pelvis and into the abdomen. That breath moves the abdominal tissue out. It moves that pelvic floor down. As you exhale, the belly comes back in, the pelvic floor comes back up. So it's a nice, gentle massage of those muscles just with breathing.
Okay.
Then we can start connecting, which is why I love exhale on the way up, breathe in on the way down. If your pelvic floor, if we're in lateral lunge today, as we're stretching to the side, your perineum is stretching as you move over. So breathe into that tissue. Go ahead and get some extra length with that inhale. As you come back, we're going to exhale to help kind of bring it back up, help support it. I don't even have to squeeze the pelvic floor at this point. I don't have any pelvic floor issues. I'm just using my breath to control my core and pelvic floor. If I have pelvic floor issues or core issues, then we can tap into the guidance of, okay, let's connect our pelvic floor with breath. Let's connect our zip up, our belly button with breath, so they can work together as a team.
Okay. I like that. So you posed a very good question. What comes first, the chicken or the egg? What do you think?
I think people get so busy when they're stressed and anxious that they just hold it and they kind of forget about themselves.
Okay. Okay.
I do.
So we need to remember that all muscles need to be
Relaxed,
contracted.
length. Yeah. No muscle is meant to hold tension for that long.
Okay.
Because if you did it with your arms, it's easy for us to see. You would be walking around with dinosaur arms.
Yes.
No one's going to let you do that.
Yeah.
Right?
Yeah.
You'd be like, dude, take a break. Right?
Yeah.
Relax it out.
Chill out.
We can't see that on the pelvic floor. They're inside. Breathing, people don't typically watch you breathe.
Right.
So it's really checking yourself, taking a moment to see, okay, what am I doing if I lay down on my back, one hand on my chest, one hand on my belly? If I focus just on breathing without even thinking about it, what's moving?
That makes sense. Okay.
Am I just breathing up here, not moving down
and you
here?
You don't want to do that. You
No.
want to breathe with your rib cage.
Right. And like as a runner, runners will tend to get more upper chest breathing.
Mm-hmm.
So then we got to start to target outside of running. How can I actually use my diaphragm to breathe more into that cavity?
Yeah. And you're speaking of like running in physical performance. One thing that I'm picking up in between as you're laying this down, and I'm picking it all up, by the way. The pelvic floor itself, what I hear you saying, I think, you correct me if I'm wrong, is it's actually a performance muscle. It's actually something that if you're looking to perform at your highest peak performance, you can't have a peak performance conversation physically without a core and pelvic floor conversation as well. Yeah.
Yeah.
You're telling me that?
Uh-huh.
All right.
That's how I feel.
Well, I gotta do more. Do I have to do more than my Kundalini meditation breathing in order for me to activate my?
If you're not having any issues, I would say you're moving your pelvic floor on leg day.
Yeah.
You're moving it on athletic conditioning day. Mm-hmm. It's moving with you. Mm-hmm. Anytime we squat, hip hinge, lunge, any of those activities, the pelvic floor has to stretch in those positions as your sits bones, your bony butt, spreads apart in a squat, spreads apart in a hip hinge, a lunge. They stretch as they come back together. You come up to standing, knees not bent, they come back together. You bend your knees and squat, they're going to stretch out. So it's moving with you.
Right.
It's until when you start to recognize like, oh my gosh, I'm peeing my pants. That's not normal.
Not normal.
Yeah.
Right.
Oh my gosh, I have pressure down there. That's not normal.
So if you have pressure or you're peeing your pants,
or you have pain.
This isn't just you then. This isn't like, I know a lot of my members would just chalk it up to be like, this is me. I mean, I can remember a specific day. You want to hear my story?
Sure.
Okay. We're in the Huntersville Burn Boot Camp right now.
I think you're Chelsea. I probably just have it mislabeled. Sorry.
All right, Chelsea. We can just pull up something on Amanda's YouTube, and we're gonna react to one of her videos. Make it a short one. Make it like a minute or less than a minute if you can, and we'll react to whatever comes on the screen. Because she did all this stuff, so she's going to be able to know it really well. Maybe we'll play a couple throughout the podcast. What were we talking about? Performance.
Yes, your pelvic floor.
Okay. So if I need to, if I'm having a conversation of peak performance, I can't have that conversation without strengthening my pelvic floor, or at least having it being at normal functionality. Does my Kundalini breathing, does my breath work, and the fact that I don't have asymptomatic, does this actually mean that I don't have much work to do on it, or that my normal kind of day-to-day routine is working? And is this one of those issues that, you know, some people just have to run into the actual physical issue in order to even notice it, and then boom, now we can take care of it?
For you and your work with the squeezing that you're doing down there, I would just make sure that you are bringing it all the way back down. Like focusing on that release, the elevator coming all the way back down to the lobby, because you don't need to hang out in a hotel. Eventually you want to leave, you want to sightsee, right? So you're bringing it up like to the second, fourth floor of the hotel. Let it come all the way back down.
Okay.
I think where people got caught in the early 2000s and mid 2000s was they were Kegling and then staying there.
Just holding a Kegel.
Holding it. So if you are ever practicing that, make sure it comes all the way back down. Because again, most muscles, all muscles, not most, all muscles need to contract and relax.
Yeah.
So you've got to get that full range of motion there.
Got it. So this is like one time that I get to like talk about Patricia, and it's appropriate right here, because like normally if I talk about female lady parts like this, it's not appropriate, but since you're holding Patricia, it gives me, it's appropriate. Where show me when I think of the perennial muscles, show me the bony part of my butt. When I sit down and I'm sitting down and I feel like, oh, my butt is okay.
Sits bones.
That's okay. Sits bones.
Sits bones. Yeah.
Sits bones, like for sitting. Sits bones.
SITZ.
Okay.
That's how I spell it.
Okay. Good. And now continue to walk through like just the rest of the anatomy here so that we know exactly what's going on.
All right. So females have 3 openings: the urethra, vaginal opening, and the anus. Okay. Clitoris is up top. You have 3 main muscles for the superficial muscles. One is a figure 8 that loops around the vaginal opening, up around the clitoris, back around the anus. So figure 8 intercepts with the perineum. Across here, the perineum or transverse.
And we're not seeing muscle. The perineum. You're imagining it. It's over the top right now, right?
Skin is on top of this stuff.
Yep.
So this muscle here, which is broken on my side because my kids have broken
I got it.
Loops horizontal. So that's your horizontal muscle. It then intersects with an upside down V muscle here.
I see it.
So we've got 3 muscles, male or female, that make up the superficial or the front portion of the pelvic floor. These are mostly like sexual in function or sphincteric. So they want to keep your goodies in. When you're out in public, you don't want to pass gas, right? So you squeeze these muscles. Then you get to a place where you can relax the muscles to pass gas. You open up those muscles. Or you go sit down and have a bowel movement. So we don't want things just sliding out.
Right.
We want them to have control, which is where it comes down to it is not normal to pee your pants. It is common.
Got it.
Then underneath that is more of the support system.
Okay.
So these guys hold up our organs.
Yep.
So bladder, bowel, uterus for females, prostate for males, all in here, all intersected. If you have an organ removed, that's a supportive organ. So things are going to shift. So you want to make sure before you go have an organ removed, whether it's your prostate or your uterus or whatnot, that maybe seek out some exercises, seek out some help to help maintain good behavioral modifications down here, meaning like how am I pooping and peeing? Do I need to strengthen the muscles down here before that organ's removed to then build up that strength and stability again because they're holding them in place?
I've heard you use the word tone a couple times, and I'm assuming that would mean the same thing in corrective exercise science, where like you have a ropey, tight tonal muscle. It means it's tight, it's overly active. It's like in a permanent contraction almost.
Yeah. See that a lot. And there's a lot of muscles down here.
Right.
So sometimes it could be muscles on the left side. Sometimes it could be muscles on the right. You have 3 different layers of muscle tissue. Sometimes it's just the front. Sometimes it's all 3. So there's lots of scenarios. I tend to find majority of my clients tend to be more tight in the back. So type A personalities with how they're holding posture. Again, if we've stretched out the abdominal tissue with pregnancy, postpartum, then we tend to be more type B personalities in the front. That's not everyone. Sometimes
what's
if
the
it's
difference? Say that again. The type A and type B.
So if my clients are like holding their posture like this, right? So pregnancy, they tend to hold their posture where they're squeezing their butt to hold them up. They'll be more tight in the back or on the sits bones.
Yes.
More loosey-goosey in the front where I'll say, oh, they're on vacation. They're more like type B personalities. We want to get them on the same team again, making them work
because of the posture
together.
that
posture plays a huge role.
And your posture changes dramatically when you're undergoing pregnancy.
Pregnancy, it could even be, though, people who are working from home at a computer all day for 8 hours. If you're sitting, what's your posture like? You're not on those sits bones. You're going to be off those sits bones. Your butt's going to be tucked. You're going to have more tension in the back. So even when you're sitting, thinking of sitting up on those sits bones to really get the pelvic floor and core to work for you.
It's almost like that. If you could anteriorly tilt your hips forward, but then you posteriorly tilt them backward.
Find a neutral.
That's kind of, you want to kind of find that neutral.
Yeah.
I'm trying to do that as you're talking right now.
So you can go as far as you want and then come back off of it a little.
Well, it actually feels way more comfortable. Like we'll have a tendency to sit with the hips folded forward, anterior position. And I think it just to have that gentle reminder of that. I also feel my lower back muscles activating to help pull the pelvis back too. So you're just talking about be mindful around the way you're sitting because your posture has something to do with your pelvic floor, which has something to do with your performance. So therefore your posture and performance are one.
My husband's going to kill me because this is also going to go with standing desk.
Okay.
So when he first
he doesn't like standing desks or something?
When he first got his standing desk, he had a lot of tailbone pain.
Okay.
So we had to go through, let's look at your posture. Well, he would stand and then he gets tired standing at a desk. So he thrusts his pelvis forward, right? So you're hinging still, poor posture, whether you're in standing desk or sitting. So you got to be mindful in both cases.
Okay, so now let's stick on this topic. We're talking about, because this is a thing, right? People are trying to be active while they're working. They got walking desks and sitting desks and stability balls. I personally just like to be on my phone, and my team thinks I'm crazy, but like I'll go outside and I have no shame. Like, I don't care if people make fun of me. It doesn't matter to me. I enjoy sunlight and I want to get sunlight. So I'll take my shirt off and I'll just walk around the building, just talking on the phone to whoever. And this type of activation, postural activation, is probably better, I'm assuming, you tell me, than sitting at a desk on a stability ball or something like that. You'd rather, a body in motion tends to stay in motion. You'd rather be in motion than doing something. So do you, when it comes to the peak performance and pelvic floor and posture, what do you think about stability balls as you sit down, or all these different apparatuses? The one I love the most, can I just make fun of something real quick? And I'm so sorry if you have one of these at home. You need to immediately get rid of it just because I fear for your reputation as a human. No, I'm just kidding. But you know, the one where I sit down and it's just like the little block, and then it has like 2 pedals on it. And you sit down at your desk and you put it under your desk and you just have the pedals, and they go like this.
The recumbent bikes.
Kind of, but you're not moving anything else, but it's just like these 2 little pedals. I don't know. I just think that does it too much. But I'm not the expert, and I looked at all these things, standing desks, you name it. What's the best when it comes to pelvic floor health and peak performance?
Out of all those?
Yeah, sure. Rank order a couple of them for me, because I know everyone out there does their own form of, like, you know, postural heroism at their desk, you know? And like, somebody texted me the other day, I've been walking for 3 hours while I'm working. I'm like, I can't tell you whether I should be clapping for you or booing you down.
My thing is everything in moderation.
Okay.
Honestly. And I'll give you a reasoning why. The stability ball I like for people for pregnancy and postpartum, not for sitting, but do exercises on it. Sitting, you're going to get in the same poor posture habits on a stability ball as you are in a regular chair. So pick what you want to sit on. The walking pads and walking treadmills, I feel like, have gotten, for me on the pelvic floor side, the clients will end up seeing me because they jump into walking way more minutes than they probably have already built up the stamina to. So I had a patient who was 4 weeks postpartum who started walking on her treadmill because she went back to work, owned her own business, right? Most of us get back to work before we need to, and started walking on the treadmill to answer emails and answer clients, but she went 4 hours. Your pelvic floor wasn't ready for that. So then we developed pelvic organ prolapse. So she started having pressure down there. Things had shifted. Her pelvic floor wasn't ready to walk 4 hours. So we had to really work on what had she done prior. Well, she hadn't walked at all. She just went straight from 0 to 4 hours. And I have had a couple clients like that have jumped way too far into it. So if you have the stand-up desk or the walking desk or the walking pad, like, build up the same way you would outside if you went for a walk. You've got to build up the endurance. You can't just go 4 or 3 hours of your day. It's not great for the pelvic floor.
Well, one thing I hear you saying that I think is really interesting, an interesting thread to pull on, is how do I put this? Like almost like the pelvic floor is more controlled by your brain and the mind muscle connection more so than anything else. It's one of those muscles that you don't really have to think about to use it. It's going to be subconsciously used on its own. But it's a unique muscle that when you do put your mind to it, you know, like, you can't really do that with the other subconscious muscles. It's a unique muscle in that regard.
Yeah.
A set of muscles in that regard. It's like, no, you kind of have to put your mind to it to, like, lift a weight. But, you know, do you know what I'm saying? Like, there's this like subconscious conscious. It kind of sits in that realm of,
kind of like the core does too. Like, if you have back pain, it kind of gets turned off. So you have to rewire your brain with those muscles to make it fire again. And the same way goes with the pelvic floor. Like, we go through points where in rehab where we need to be mindful about how we're using them, but then we outgrow that, and then they should be firing on leg day without us having to think about it. Right? And we shouldn't have symptoms anymore because we've gone past that level of rehab, and now we're working on different exercises to make them fire and build up strength.
Yeah. So this is really, your whole career and your whole practice is really an exercise and, like, neuromuscular connection. Mm-hmm. Yeah. So it's like how the brain can control the body, which I think is super fascinating. And then you give a bunch of exercises on your YouTube, and I want to point everybody to YouTube because you have some amazing things on here. Chelsea is going to pull up a couple of these videos here in a minute, and We tried to find the butterfly one, but there's so many of them that we're not going to be able to do that, I don't think. But Chelsea, just roll a random video. I want to get
So
our
there's
reaction.
like the half kneeling one.
This exercise, we're going to work on pressure management while moving from the floor to standing. So first, I want you to do this on each side without any weight. We're going to work on blowing out. We may even blow out and suck up a smoothie down here for a little bit more support as we stand up. You can switch legs, come back down on the opposite side, nice and controlled. Breathe in, blow out, suck up that smoothie to stand. Switch legs again, come back down. All right, so we know how it feels without weight. Then you've got your weight down on the ground. This is 10 pounds, as if my baby were 10 pounds, or I'm lifting up a laundry basket that's 10 pounds. I'm gonna blow out as I pick the weight up. I'm gonna inhale, I'm gonna blow out, suck up that smoothie down there as I stand. I'm gonna come down on the opposite leg, so you're gonna switch legs, nice and controlled on the way down. Again, blow out, suck up that smoothie. Go to stand, switch legs, come back down, nice and controlled. Breathe in, blow out, suck up that smoothie.
For those of you that are listening and you're not watching, by the way, we're on YouTube and we're doing really good, guys, by the way, on YouTube. So you got to go over YouTube and make sure you subscribe and what do they say, Chelsea? Ring the bell. Ring the bell. That way you get all the notifications of when we put out new podcasts. But if you're watching this on YouTube, then you're going to see that we're showing Amanda do the half kneeling to standing with the pelvic floor as a pelvic floor exercise. And it reminds me of going back to the meditation. It reminds me of Kundalini breathing because you say like, suck up the smoothie. And in Kundalini, they say, suck your energy up a straw that is going up from your perennial muscles to your brain, to your
Do you know why we get cues
gland.
like that?
Because if you tried to like break down the exercise science of it, you go way over people's head. That would be my number one guess. But
Your head and your pelvic floor were split
okay,
8 weeks when you were a fetus. So inside your mom's belly, your head and your rump split. So they're the same muscles. So layer one of lips here on your face is the same of lips down here. So sometimes I'll even say lips to lips, baby. Because if you want your suction or your sphincter to work down there, sometimes you got to connect the sphincter here.
okay.
Same thing goes with...
Wow, I didn't realize that.
So when you think of like sucking up a straw down there, your brain is also here thinking, what happens here?
Wow, I did not realize that. So as an embryo, your mouth and your butt are connected.
At 8 weeks, until 8 weeks, and then they split.
My
mind
mind was just blown.
People who clench their jaw,
Yeah.
same thing. Their pelvic floor is most likely tight too. So if they have things that they're wearing at night to help with their jaw clenching, you want to get them doing some mobility exercises. Oh, butterfly on wall. Find that video somewhere. I'll go rename it.
Or this one, the half
Get it to
kneeling one.
relax
This one is good too. So what are you teaching people to do here as they're on one knee in a split squat position? You're having them go body weight or pick up a weight and then do stuff. As we stand up?
So we're blowing out, connecting the pelvic floor. A lot of my moms are pretty dominant on one leg, right leg or left leg, kind of like their arms. So when they get their baby up off the ground, they're always using one side. So we're trying to train the pelvic floor and build up the strength and the glutes and the pelvic floor as they're getting up off the floor. And then eventually we'll add in the weight, putting more core into it, where we're either going out in front or also going into more of an overhead press. Mm-hmm. Again, focusing probably at that point more on our zip ups, which is connecting pelvic floor, lower core, and following it all the way up to the breastbone. A lot of core people, when they fire their core, tend to go more in and then push down into their pelvic floor. So we'll see this pressure kind of fold underneath their ribs and then go down into the pelvis, creating pelvic floor dysfunction. So really reminding that core how to fire with exercises like this.
Okay, so I have a exercise science question for you. This one just came to me because...
Then I can answer this.
No, yeah, I mean, if you can, it's okay. It's just we can look it up on GPT or we can look it up on Google and get a baseline. But I think you can because you are in the gym, you're lifting heavy, you're doing your PRs during our mesocycles, at least Summit, and we're lifting heavy, right? Now, lifting heavy without a strong pelvic floor can be an issue. You can actually, based on everything that you're saying, listen, I'm not an expert. I'm only assuming from our conversation today that if you are somebody who's strong, but maybe you did 250 camps or 500 camps before you had baby one, and then you have baby one, and then you come back, you're still strong. You don't lose your muscle, but your core and your pelvic floor have been locally disrupted, or I mean,
little injury.
Like
anything from a whiplash to torn tissue.
Yeah. Okay.
No idea what's happening down there.
Okay, and you can explain. Let me get this question out, and then you can go further and explain that, because I think that's interesting. So when we lift, there's this breathing technique in lifting called the Valsalva maneuver. And what that's going to teach you to do is that if you want to lift the maximum amount of weight to get your PRs up, that for that rep, that you actually increase the internal pressure by holding your breath. And what you're saying is when I increase the internal pressure, I'm pushing down.
Yep.
And if I don't have a functional pelvic floor, then I can actually push down in Valsalva without the proper contraction to offset. And now all of a sudden, all the muscles around my pelvic floor are strong. I can do the PR, but now I'm starting to get this pelvic pain because maybe my muscles around it are getting stronger. Valsalva maneuver, yes or no?
I think it depends on symptoms. So if we're having the pain, can we add in mobility outside of that lifting as well to see if we can get that pain to go away? If it's more bladder leakage or pelvic pressure, that's when I will usually encourage clients to the weight for your legs, that PR might be great, but your pelvic floor, the PR is going to probably be a little bit lower. So can we build up more strength and endurance at a little bit lower level and build back up to it to see if we can meet it where it's at? Because maybe your legs are ahead of the pelvic floor at that point. I have been taught more side on blowing out with the lifting. That was just my training with female athlete CEUs that I've done. But I do know in the CrossFit, when we get into that heavy, heavy stuff, like that is how we are trained.
Valsalva maneuver's bodybuilding principle, and it's a powerlifting principle as well. And it does help you to get more weight. It's definitely something that helps. You can't do it for all 10 reps, though. It's like a 1 or 2 rep thing.
Yeah.
And it's pretty common in lifting. But I'm just curious if trainers should promote the Valsalva maneuver if they don't have any knowledge of pelvic floor health. And I would think that your answer would be probably not. Maybe you want to ask somebody before they start deadlifting 120 pounds in each hand. We have 120 and 150 pound dumbbells circulating out there in Burn Nation now.
It's amazing.
Our members are getting strong, and 95% of them remain female to this day. Shout out to my Burn Bros anyway.
Whoop, whoop. My
5%ers, let's go. But you're saying that we should probably understand our pelvic floor health before then going to do some like technical internal breathing manipulation for pressure to help us lift more.
Yes.
Okay. Hey, listen, I want to know the answer. So as if I'm training you out there and we're going to go lift 120s, I might check now with you. Hey, how's everything feeling? You good?
And if they're good, they're not peeing their pants, there's no pressure, there's no pelvic pain, great. Let's keep going.
Okay. So if there are no symptoms, then you're usually, generally speaking, not a lot of limitations. But if you do have symptoms,
your body's talking to you.
You really want to limit yourself and get that problem right, because you can actually, exacerbate that problem if you do too much lifting around a weak pelvic floor. You can actually make it worse, or at least make it harder to retrain.
Yeah.
Okay.
And a lot of times too, when a lot of my clients that are working out and if they're having symptoms, most often they're not truly weak. There's usually built up some high tone somewhere in those muscles down there. So they're picking up or compensating for lack of strength and stability that we have somewhere inside the pelvis. So it's not always a weak issue. Sometimes it's just getting the muscles to talk to each other and work together as a team to take off the stress that one maybe is overworking and allow the other muscles to do its job too. So then you've got everybody working together as a team. It should function better as a muscle group than being run down with leakage, pressure, or pain.
So are there any famous people or famous cases that we would know about when it comes to pelvic floor that you've studied or that you've researched that other people might have heard about before? Anyone come to mind?
Gosh, there was a CrossFit, you'll see bladder leakage all the time at their events. There was a marathon runner who went and ran a marathon right after she had a baby.
Okay.
That one was pretty big.
And these are just cases of how not to do it the right way, essentially.
I feel like they got a lot of bad rep, or running while pregnant got a lot of bad rep.
What do you think about lifting really heavy when you're pregnant? I know that
if you've been doing it and things look good,
Yeah.
I would keep doing it.
Okay.
It's all comes down to your doctor and your heart rate, like things to just check and make sure things are going okay. But if you're diastasis, if you can control that, let's go.
I have a friend that's in the Charlotte area. Her name is Emily Breeze, and she's been a popular influencer for a while now. And she was one of the original barbell, kind of universal barbell lifters. I think she was doing CrossFit at the time. And she was like deadlifting a bunch of weight or doing a clean and snatch or whatever. There's Olympic bar lifts, right? That would be fine but then she was doing them pregnant, and people started saying, don't do that, blah, 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 being like the computer keyboard warriors or whatever. And like, I kind of like look back now at all of that, and like, she's perfectly healthy. Her knees are perfectly healthy.
And it's totally, it's changed so much too, since like you guys have probably had kids and I've had kids. My first pregnancy, I had to keep my heart rate, like under 120, which is crazy.
Right.
And I was training for a half marathon and just was kind of like, screw this. I'm going to keep doing what I've been doing.
Right.
So, and then like the second one came around, it was like, oh, you could go up a little bit higher. Oh, and third one, as long as you feel okay, just go ahead and keep doing it. And that was a matter of 6 years between kids. So much had changed with that. So when it comes to the lifting and working out, like I like to prep my clients for the fourth trimester, but also for the delivery. I want to make sure that, yes, we're building up strength, but we're also keeping it mobile. So we're going to have that range of motion for that tissue to be able to stretch 10 times its length to deliver that watermelon out of your belly and your vagina without hopefully any complications. I
just really quickly pulled up a search because I was curious about any other famous cases. Have you heard of Zosia Mamet, who is the American actress best known for her role Susahana Sapiro on HBO's Girls? Have you heard of this case?
No.
Oh, okay, good. This will be a good one. Maybe you can use this in your future teachings, because her father, David Mamet, got her into acting, and she was like invisibly struggling silently from a chronic pelvic floor dysfunction, and for much of her life, she battled some unexplained pelvic pain, urinary urgency, discomfort that her doctors often kind of dismissed or misdiagnosed. But it wasn't until adulthood when she finally realized that she received this accurate diagnosis, which was targeted around pelvic floor therapy, which transformed her life, especially on set, because apparently the urinary urgency was a big deal on set. And she had a couple run-ins with like showrunners and things like that, because these showrunners on movie sets, like we have a light version of it here in our studio, Chelsea, Jordan, they're the showrunners, and they keep us on track. On a movie set, it's even more important because it's a much bigger production. And so it was actually impacting her career. She was having to go to the bathroom all the time. And so the article says that she had since spoken out about her experience helping to break the stigma around women's pelvic floor health, that it's a topic rarely discussed, even in the medical or fitness circles, which is why I'm so happy that you're here to discuss it. And her story is one that underscores how easily pelvic floor issues can go unnoticed, misinterpreted. Back pain, anxiety is a lot of the misinterpretations, misdiagnosis that she got. And she got a proper diagnosis and was able to rehab. And by her own claims that this is a really life-changing thing, and she wrote about it publicly. Zosia, I think is how you pronounce her first name. I've never seen the show. I know her face when I've seen her face, but I don't know much about her other than that. So I just did a quick search. And what sticks out to you about that story?
Yeah, high tone pelvic floor. Mm-hmm. So when the muscles are more tight, they're closer to the bladder. And I like to say, like, the bladder wants space. It feels claustrophobic. So those muscles get up nice and tight there. The bladder feels the muscles and it senses like, I can't stretch anymore. I can't fill up with more fluid. I must be full. So you get this signal of urgency. I need to go to the bathroom. So then you would have to go pee. For her, if the muscles are more tight, we want to work on lengthening or stretching them back out, give the bladder more space to be able to stretch and fill back up. We see this a lot after high tone pelvic floors. This would be like endometriosis, PCOS, or women who have, let's say, cesareans. So C-sections, that scar tissue can scar down around the bladder too, creating the similar feeling of bladder urgency. And we need to stretch that out with mobility. Sometimes it's the use of a pelvic wand, which I absolutely love.
What's that?
A pelvic wand, it looks just like a Theracane if you've ever been to physical therapy.
Can you Google one of those, Chelsea?
Intimate Rose pelvic wand. The temperature regulated one is my absolute favorite. It's yellow. And for patients like her, or clients like her, this wand, this yellow one, you can actually make hot or cold. So if warmth helps to relax the tissue, we would warm up this wand, and you can then take a warm wand and put that in on the muscles to be able to stretch the tissue out. So that wider end actually inserts into the vaginal canal, and we help to stretch that tissue like a letter C.
Go and show this.
Could be one. Or you could do, which is kind of like talking about the pelvis is like a pelvic clock. So the top of the clock would be the clitoral urethra area. Bottom of the clock is more of the perineal area, that Uranus area, anus area. We want to stretch around the clock like the letter C to help lengthen the tissue. We would teach them how to contract around the pelvic floor, how to relax it out, help stretch or guide the tissue back out. It's very gentle. The skinnier end is for the deeper part of the pelvic floor. That's what I use it for. I know originally it was made to help stretch rectal tissue, but I use it to help get into the hip muscles in the pelvic floor and the deeper backside of the pelvic floor. So I honestly believe anybody who starts a period should get a wand. I feel like that should be like, welcome to womanhood. This is for you. Because
so this is a core tool for you.
I love this sucker. Yeah. Yes. So all my virtual clients, I mentioned to you, I'm working with virtual clients. Everyone gets a wand. I send them a wand.
How can people work with you virtually if they want to?
They can go send me a message on Instagram or go to my website, empoweryourpelvis.com. But
pull up her Instagram real quick. I want you guys to know where to go. If you're somebody who is you notice that, hey, maybe I have some of these issues. Maybe I do resonate with some of the stuff that we're talking about here. Empower.your.pelvis, Empower Your Pelvis on Instagram. Okay. This is Amanda.
And there's a work with us.
Yep.
So there's my story. It goes a little bit more into detail, my pelvic floor history. And then the work with us, you can comment strong, or you can even send me a DM strong, and I will connect with you on that. But the pelvic wand is a huge tool. Dilators is another tool out there for patients that are having like pain with intimacy. The wand is also used. Why I would give it to somebody after they start their period is a lot of our young girls and young female athletes are having pain with inserting tampons. So really helping them work through inserting their tampon to feel comfortable and confident, whether they're out on the field or running college track. A lot of them are still in like menstrual pads. So giving them the confidence to be able to do that activity. And then our hormones change our pelvic floor muscles throughout our lifespan. So that wand, unless a better tool comes out, I tell people keep it with you, put it in a nightstand, save it. There's going to be periods of your life where you're not using it, but there'll be times where we'll need it again to help tap into those pelvic floor muscles.
So in Zosia's story, she talks about being misdiagnosed. And so when it comes to the misdiagnosis, what's usually that, like, if I'm somebody at home right now and I'm like, I might need this. I might there's something isn't right. If you have that intuition, what am I usually feeling? Because it won't be so obvious that, oh, I have this, most people don't even know, what the pelvis is if you ask them.
Yeah.
Which isn't bad. It's just anatomy is hard.
Yeah.
So what are they usually feeling? What mindset are they usually in? Is peeing your pants a telltale sign? Does everyone have that? Is it back pain? You hear all these things. How was Mrs. Mamet here from HBO's Girls? How was she misdiagnosed from your perspective? Like, well, you don't have to be spot on. But
I have no idea what
just generally speaking, I'm sure she falls into the general category of being misdiagnosed.
Yeah. If you go into your doctor and you're having low back pain, your pelvic floor muscles attached to the low back, so they can be pulling on that sacral area and on the low back spine area. Hip pain, because they attach, you have your hip rotators down in the pelvic floor and they attach up to the pubic bone. So some people have hip pain while running or working out. Pain with bowel movements, lower abdominal cramping and pain. If it's going on for certain periods of your monthly cycle, or you might find that it is cyclical, like it might only be happening during ovulation or the week before your period. Like, you can start to pay attention to your symptoms peeing your pants, pressure, pelvic pain of any kind, no muscle should be painful. If you feel your biceps or triceps, like they shouldn't be uncomfortable right now unless you did a workout with DK, I'm assuming. But it should be very
real uncomfortable after that.
It should be very comfortable to touch that tissue. The pelvic floor should be the same way. But if there's ever pain down there, know that that's not how it's supposed to feel. It should feel, again, just like you're touching any other muscle.
So in that sense, a tight pelvic floor and a weak pelvic floor are both problems.
Yeah, I like to address the tension first.
Okay.
Because think of biceps.
Mm-hmm.
If we're just doing bicep curls here, we're not really strengthening the full muscle, right? We're just going to make it more tight. So that's how the pelvic floor. If the pelvic floor is tight here and I ask somebody to Kegel or I'm testing someone's strength and it barely moves, I'm not getting a good version of what their pelvic floor strength is. I'm getting it to move very small percentage.
Mm-hmm.
So we have to work on lengthening that tissue out to truly see how that pelvic floor is functioning. So I'm not going to give Kegels to somebody. We're going to work on stretching exercise. That could be eccentric loading too. It doesn't have to just be mobility. Mm-hmm. But I want to get that tissue to let go and start moving in the correct way so we can get a good, clear picture of what's happening.
You also mentioned intercourse was the way that you figured out that you had something going on.
Yeah.
And so as the pelvic floor can not only affect your peak performance in the gym, but also impacts your sex life.
Which is also an athletic activity.
It can't definitely get your heart rate up, people.
Yep.
Make more babies. That's what we need to be doing out here. Making more babies. Digestion, emotional health can also be impacted here. So sex life, digestion, emotional health.
All of it.
It impacts more than your workouts. And I think that's one of the points that I want to get across.
I feel,
go ahead.
Sorry. So touching on the bowel side,
yeah.
I would say more people have constipation and don't realize that that's a lot with your pelvic floor and lower abdomen too, because everyone will come in and say, well, I've always been constipated. Okay, well, let's dive into why. And then there's a lot that happens to make things move through your body. Like we look at the fiber, we look at what we're eating, our hydration, but then you also have to have mobility in the abdomen and in the pelvic floor to get stuff out. You have to have the muscles that are letting things out. They can't be so tight that they're keeping it in. So I will say that's pretty top-notch symptom that people come in with too, on top of their pelvic pain or
that makes sense
issues that they're dealing
Got
with.
it. So if I'm somebody, and maybe we've answered this in some way so far, but just to ask more straightforwardly, if I'm somebody who is sitting here right now, and I'm like, I don't know, maybe not. I'm right on the fence of whether I need to see somebody or not. Is there a test? You mentioned you're testing people. Is there a test that I can just do by myself to say, oh yeah, I'm definitely not in a situation where I need to come see you?
My questions are usually straightforward on, are we peeing our pants? Do we have any kind of pelvic pressure? How often are you peeing or pooping?
Pelvic pressure would feel like a cramp?
It could feel like a cramp down there. It could also feel like, for women, we say like a used tampon down there.
Okay.
Like you're just feeling like a bulge.
Okay.
Down there. Tailbone pain, low back pain, hip pain. Are we having any of that? And then the pain with intercourse, pain with intimacy, unwanted pain with intimacy. So there's a whole story there. But again, trying to keep it nice and comfortable.
Yes. Okay. All right. So yeah. So if I have any of the things that you just laid out, then I probably want to come see you.
Yeah, I would reach out to somebody.
Okay. All right, let's go back one more time. Let's play one more video from your YouTube channel. Just pick a random one. We're going to have Amanda break it down. And if you want to go to her channel on YouTube, everybody, it's Your Pelvis, Empower Your Pelvis videos. Empower Your Pelvis.
Hip 90-90 on the left, right there. Yep.
Hip 90-90.
This one I will show in my burn videos a lot to do before warm-up.
Okay, let's roll this one. What are we watching here, by the way, before we start?
We're watching an ad.
Go ahead and pause that ad.
So I'm tapping into the hip rotators. So we've got one leg in front, one leg behind, and then doing that on the opposite side. So many people will comment and say, my hips don't move that way.
Okay.
Well, then let's
start to move them that way. Okay. So 90-90.
First stretch we're going to do today is hip 90-90. So we're going to put one leg in front, one leg behind. We're going to start out in this position. You can reach over, away, where you might get a little bit of stretch in the front of the pelvis here. Reaching the opposite. Can we open up that shoulder? Open up that other side. Then we're going to go forward towards that shin and then out towards the knee as well. Then we're going to alternate. So go to switch sides, opposite leg in front, opposite leg behind. Start out reaching over to the side with the leg in front. Over to the other side, get a nice stretch. When you feel tension, breathe into that tightness. And back out. Forward into the front of the shin, towards that shin. And then over towards that knee.
So you're shifting, you're putting your
you can
front leg
on your sit
up into that almost like pigeon position.
Knee side to side. Get into that tissue a little bit more as you're rotating them side to side.
And and then you're rotating side to side. Okay. Yeah, that's good for just hip mobility in general.
Yeah.
What specifically is this doing for the pelvic floor?
So this is part of the pelvic floor. Your hip rotators are in the pelvic floor. People are nice and tight here.
I'm nice and tight there.
Yeah. So you've got to get this stuff to loosen up. So sometimes we'll use the wand. Well, I love first and foremost, move your body. Let's do that first. And then there's other ways that we can tap into it. But the hip 90-90, if people can just start to sit in this posture even, it's great for the vagal nerve. That's a whole other discussion too. But instead of sitting like crisscross applesauce on the floor, like if you guys are having family game night or sitting with your kids, try to get into hip 90-90 because it fixes your natural posture too, makes your core work. But then we're tapping into that pelvic floor just a little bit more on that range of motion side. You'll feel it different one side versus the other. You may feel it in the groin more on one side, more in the hip, more tightness in the back. You may find yourself leaning away from it. I don't want people to get into pain with it. So we're trying to keep maybe that discomfort level at a 1 or a 2 out of 10, minimal stretching there. And then compared to like a 10 out of 10, which would be take me to the hospital. And switch sides. So this is something I like to do before I go into camp, before I get on the floating floor. I usually get into a deep squat. That's my number one stretch. My second one is getting into hip 90-90 and then rocking those knees side to side. If I've got more time, then I'll do a little bit more. But those are my go-tos.
And so in your own journey, when you were around your young 20s, you identified an issue, you fixed it right away. What has been your maintenance since then?
Leg day.
Leg day.
I don't miss a leg day. I love eccentric loading.
Okay.
So I still will have flare-ups in my own pelvic floor. A lot of it for me will come if I start pushing, I forget my mobility a little bit, and then I start pushing the envelope with maybe running. Like I mentioned to you before the show, like one of my kids is in cross country right now. So we're running more together. I can feel like a hip flare-up with that. So I make sure I have to get back into eccentrically loading my tissue a little bit more because that will stretch out my pelvic floor, make my glutes and my pelvic floor have to work together as a team. And then the mobility side that I have to get into.
Yeah, mobility around your pelvic floor is important as well.
Yeah. So those are my go-tos. I have a pelvic wand myself. Why not practice what I preach? So if I can feel my own like right hip pain or left hip pain coming on with running, sometimes I'll use the wand just as maintenance real quick, like a 1-minute stretch sesh with that and call it good.
Okay. All right. So a couple more things that I wanted to cover. So one other, and I'm trying to just give people the signs. Because to me, it's just such an elusive, sneaky type of thing. Like it can be obvious if you're looking for it.
Yeah.
But sometimes, from my experience, like a member downstairs would, here's a good one. Somebody would sneeze, and then when they would sneeze, it would pee a little bit, and so it had nothing to do with jump roping, and they then started to identify as this person who's a sneeze peer. And like it became a part of their identity. Yeah, like peasing. Yeah. Oh, did you just make that up, or have you heard about? Is that something?
It's something in our world.
Okay. I was gonna say, yeah, the peaser. But they were like identifying as that, which I'm good at catching those type of things. Like most of the time in my world, it's identifying as like some negative emotion that you're not, right? Or people will say like, I am fat. I'm like, no, you're not. You have a little bit of extra body fat on you.
Yeah.
Otherwise, you're strong, you're courageous, you're confident, you're an outstanding. Like these are the things that you are. You're an outstanding mother. You're a dependable person. Like these are the things that you are. You're not fat. You just have a little bit of body fat. One of the old Instagram memes, one of my favorite health and fitness memes ever, is like, you have fingernails too. You're not a fingernail. People will say like, I'm fat. It's like, no, you have fat. You also have fingernails. You don't say I'm a fingernail.
I've never heard that before.
You say I have a fingernail. You're like, you know what I mean?
Yeah.
It's just this weird way that we identify ourselves with some tissue on our body. We identify ourselves with it. And I see this, I have seen this same thing. Like I pee every time I jump rope, becomes a part of your identity. Then you're somebody who's not a jump roper.
Fix it.
Yeah, let's fix it.
Please.
All right, now preach, because we've covered a lot of like the physical stuff and ailments and what to look out for. Now the mental side of it. Like what mindset do you see people that are successful in this versus ones that are unsuccessful in this? What's the difference?
Whatever you're consistent at, you're going to continue to see those results, right? We see that whatever we're doing. So if you continue to jump a certain way and we continue to pee our pants, then we're going to continue to do that. But why don't we shift it, figure out what we're doing wrong, and get consistent at that to see positive changes down there. So we can be the person that's not identifying if peeing our pants with jumping, sneezing, laughing, coughing, lifting. There's lots that we can do to improve this tissue. And it's not going to go away on its own. This is muscle tissue. You can't just continue to do the same thing over and over and see positive results because you're seeing negative results. It's not going to change. So we've got to change the tissue. It's very easy to do. We see it all the time. We can improve it. And yeah, I think that I'm right there with you. Like in my head, I'm like, if we just did this one thing and we tried that, we could start to see change. Sneezing is an exercise I give my virtual clients. Sneezing, coughing, you turn that exercise because they're most likely sneezing at 100%.
Yeah.
Okay, your bladder just told us in your pelvic floor that can't handle the 100%.
Yeah. Let's
slow down the activity the same way we would do in the gym with something. Slow down that activity. Let's build it back up to be able to handle the endurance at 100%. It's an easy fix.
How do you slow down a sneeze?
We practice fake sneezing.
Oh, okay.
Yeah.
All right. Because if I got to let one go and I'm in the car.
But I do it in sitting and standing, right? Because most people, you don't know which position you're going to be in, and they may pee their pants just with standing or just with sitting when they're out with girlfriends. And we need to practice those scenarios the same way we would practice lifting. All of these exercises, I would say what I tell my virtual clients is like everything we do outside of you in camp are your practices for game time. Game time is your protocol.
Okay.
So if it's leg day, that is game day. Mm-hmm. But what are we doing to practice for leg day so we're not peeing our pants and we don't have these issues?
So
I like to turn things into sports.
I love your metaphors. They're resonating with me deeply. I'm a big sports fan. Menopause, perimenopause.
Yeah.
Let's go through as we get to the backside of this podcast here. Let's review this. Let's talk about everything we've talked about now in conjunction with this phase of life.
Yeah. Women will start to see a lot of their pelvic floor issues pop up during this perimenopausal timeframe that maybe they have not addressed, that they've had the bladder leakage going on or the pressure or the pelvic pain. Our hormones are shifting so much like a roller coaster during this perimenopausal state that I wish women would tap in a little bit before this perimenopause. So if you are all listening and you're not perimenopausal yet, start to watch your pelvic floor symptoms during your menstrual cycle. And I want you to keep track. Is it happening the same period of time? Follicular phase, which is your first 2 weeks, or your luteal phase, which is your last 2 weeks? And start to correlate that, because when we hit perimenopause, they're showing light a little bit more. And I feel like perimenopause tends to follow a little bit more hormonally what we're seeing during our cycle during that luteal phase. So weeks 3 and week 4, meaning we lose estrogen. It kind of drops during that phase, our plumped up hormone that helps support the muscles. We lose that, and women might be peeing their pants more or feeling more pressure down there during those 2 weeks. So in perimenopause, we're losing estrogen. It's declining, but all of our hormones are really declining, but you get what I'm trying to say. Perimenopause, we see things pop up, and women, we see bladder urgency. It's a big one. We see pain with intercourse is a big one because things get tighter due to hormonal changes. Pelvic organ pressure because we don't have the strength and stability down there to help support our organs. So women may go into having hysterectomies or bladder slings more during this time period, or right before prior to that as well. That, again, if we can start to kind of hone in what our body's telling us before perimenopause and then during perimenopause, there's a lot that we can help fix. Menopause is truly the one day after you've been menstrual cycle free. It's like that one day. And then after that day, you are postmenopausal. So I feel like the words that we're all kind of throwing around can get confusing on that. Like I don't identify myself as menopause because to me, menopause means down the road. Mm-hmm. perimenopause, I would say we're definitely seeing more signs and symptoms in this, and understanding that this is happening more around the age of 35 and up for women and can last a long time. But there's so many symptoms out there too with it. Hot flashes is your big one that women resonate with. Brain fog, cognitive issues, confidence, I feel like drops a little bit. We see frozen shoulder in the 40s. I feel like we're starting to see more joint pain around that too, that now I'm like, hormonally, what's going on? Instead of us just thinking like, oh, what did you do to your knee today? The list goes on and on. You could Google and find a ton of them.
Yeah, and as you're talking, I'm just looking up like the hormone, like what I asked the question, what hormones do and how are they shifting during a menopausal or perimenopausal state. And when you're talking about confidence, that's one thing that, it's like if somebody doesn't understand the correlation of testosterone and confidence, well, testosterone is prevalent in women as well, and it drops, and you're going to get lower libido, lower energy, lower muscle mass during this time.
Yeah.
And, to me, that's like a lot of times people of that age, women of that age will get there and say something's changed and I don't know what it is. And a lot of my experience with members is that it actually has to do with their confidence more so than anything else.
Yeah.
That's that one thing that it's like, why don't I feel as good as I used to feel? I don't feel like myself. Well, your testosterone levels are lower than they should be. Your estrogen's fluctuating all over the place. What else is progesterone? Yeah. What's that one again? That's the ovulation hormone, right?
Mm-hmm.
Okay. And that's all over the place too.
And then you got cortisol, which shoots up because we're taking care of families. We've got jobs. We may be taking care of our parents. Schedules are all over the place. Cortisol, I feel like, is the big talk right now with all my friends of like, oh, my cortisol's off. My cortisol's off.
I want to talk to you about this because I also have a problem with this.
Yeah.
Because cortisol has this, it's you said it earlier that too much of anything is bad or too little of anything is bad. It's always in moderation. And cortisol gets this bad rep because it's like the stress hormone. But actually, cortisol itself is a key element to being able to live our lives normally, and it has to be in balance like anything else. So what are your thoughts on that? Society, like, for example, they'll say, hey, they'll take one thing and make it everything. When I say they, I'm like talking about like the influencers on Instagram that have something to sell you. And so they're going to fear monger you into believing this one like thing where it's really exaggerated and really not true at all. They'll say, hey, cortisol is the stress hormone. Cardio will increase your cortisol. And it's like, so then it's like, don't do cardio. I'm like, either A, you're fear-mongering on purpose and you're trying to sell something that this is going to trigger people, or B, you have no idea what you're actually saying, and you should set down a microphone and go pick up a journal or a paper and actually read what you're talking about before you go and you start talking about it, because prolonged release of cortisol is bad, just like prolonged release of any hormone is bad. It's the same thing. And if you have, but what's necessary is acute spikes of cortisol and conditioning, pops of conditioning. 45 minutes at Burn Boot Camp and an athletic conditioning camp is going to give you a pop of acute cortisol rather than maybe training for a marathon and never doing any strength training and just running every single day, miles on miles on miles on miles on miles on miles. That's the argument we're trying to make when we say stress hormone, bad hormone, because if you do too much cardio, then it's going to be prevalent in your body. But we fail to say, like, actually, conditioning isn't bad. Cardiovascular exercise isn't bad. Like, people are demonizing it. When, by the way, if you can remember 10 years ago, it was all about cardio and it was all about Orange Theory Fitness splat points. And it was all about how much, cardiovascular exercise you can do. And don't strength train as a woman. Yeah. You're going to get big. And so it's like, I've heard journalists say eggs are bad, eggs are good. Wine is bad, wine is good. This is bad, this is good. And it's all just this. We have to look for ourselves. So I'll let you comment on that. As you can tell, I'm fired up on the cortisol argument because I think it's used to sell more e-courses and e-books and online video, tutorials than it actually is to actually help people understand that cortisol is not only necessary, it's fundamental to have the right cortisol balance. And without it, you're in big trouble.
Yeah. My first window into that was in 2021. I had pretty much tanked my adrenals and I was going to burn and working with a functional med doc at the time. And they were like, you need to stop the HIIT workouts because of your cortisol. And so I took a couple months off of the cardio side. I still went to burn and did the strength training. But I had to kind of, I don't know, sit back on it and be like, this isn't what we would do from a bone standpoint. Like now I'm missing out on building the impact on my bones. And I think there's more pieces to the puzzle than us blaming it on cardio or HIIT workout, because if our mom is stressed out and she's got the high cortisol, let's look at what else is going on. Are we getting the sleep? Like there's so much more that goes into that than us just taking away the cardio and exercise side of it. I think that's my side of it. Like usually we're probably sleep deprived and we've got stress in other areas of our life that we may need to add in the meditation or coping mechanisms with the journaling or seeing mental health. There's lots of other things that we can do, because to me, keeping that cardio in, again, is good on that bone health and muscle side too, that we're going to need it.
Do you know how when water companies, they market their pH level? And this is just a great example of how people take something in science and they use it to their advantage, and they take advantage of people who are uninformed. And maybe it's unintentional, but I think a lot of times there is intentionality behind it. And they might believe it, but they're believing it in some vacuum or some silo in which they have somebody in their ear who actually like makes them believe this thing. And then they aren't trying to do bad in the world, but then they regurgitate it out thinking that this is how it is.
Yeah.
But it's really not that way. Kind of like a value that your parents give to you that you live by your whole life.
Yeah.
You know, or like just take the easy road or live it up because life is short. It's like, okay, I could very easily just believe that live it up because life is short, right? YOLO. What's that stand for? Oh yeah, you only live once. Yeah, you only live once. And you could very easily take that, misinterpret that, take that out into the world and live a terrible life because you only live once. If you only live once, then drugs and alcohol and all these things become fun, pleasures, impulsive things that you partake in that you don't have any control over. And so I just, when you look at the nature of the educators in the internet ecosphere, it's one of my favorite metaphors is the pH conversation, because the same way that when cortisol is kind of right in the middle, when cortisol is too high, chronic stress takes over, poor fatigue, sleep, weight gain, all that. When cortisol is too low, extreme fatigue, low blood sugar, dizziness. Like if it's too low or it's too high, it's a bad thing. With your water, pH is 7.42. That is the human pH. If you go to 10, not only does the body, we can explain the science later, but the body takes a 10 and brings it down to a 7.42. Or if you took an acidic water, is slightly acidic, it's going to bring it to balance. But if you took a 0 on a pH scale water, or you took a 60 or whatever the top end is, and you drank an alkaline water that is the highest pH level, it's like 2 pH, or it's so acidic that it literally will burn holes through your stomach. Either one of those spectrums is bad for you.
Yeah.
Being pH neutral and right in the middle is where you should be. And it's the same conversation with cortisol. It's these people waving their hand and saying, if like the water company Smart Water puts pH 10.5, it's like, just go do a Google search right now. Chelsea, do this for me. Google, is there any benefit to having a pH alkaline water above 10, or ChatGPT or whatever will give you the most straightforward answer? I already know the answer, but I just want to read it off the screen. Cortisol is the same way. We got to stop. You can't demonize. You can't give it too much credit. You can't blame it for everything. Or you can't say it is impactful for nothing, because cortisol is a hormone that needs to be regulated, or else mood swings are going to be crazy and blood sugar is going to be dysregulated and all that stuff. You're going to have a severe case if it's too high. You're going to have a severe case if it's too low. So you need those acute spikes and pops of cortisol. So let's read this. What does this say? Go ahead and pull this on the screen. All right, zoom it in. There's a lot of marketing hype around alkaline pH water, but research shows the real benefits are limited and very context dependent. But here is a balanced breakdown. Okay, your blood pH is tightly regulated between 7.35 and 7.45, 7.42, like we said. And then regardless of what you eat or drink, your lungs and kidneys do the heavy lifting here. There's misconception. It doesn't alkalize your body. Water that's at a pH of 10 doesn't alkalize your body. Your body's internal pH balance is fixed. Water can't have a meaningful change to that. It's not a detox tool, and it won't cure disease or prevent cancer. So all these marketing reasons that you would put forward a high pH to get people to buy your water and not somebody else is the exact same thing that we're doing with cortisol. It's the exact same thing. We're just doing it with an e-course rather than a water bottle or something like that. So there's good water companies, there's bad water companies, there's good educators, there's not so good educators. So I just wanted to point that out as if for anybody out there who is looking at the internet for their advice and you hear somebody say, cortisol bad, don't run ever, don't do conditioning, conditioning's bad, cardio's bad. No. Bring that person right here. We'll sit down and we'll debate about it. But you know what I mean? That's out there, isn't it?
Yep.
It's crazy.
It is.
And you probably see that in your practice too. Like,
oh yeah, I question things all the time, whether it's coming from practitioners or from the clients coming in, and you've got to really build the trust first and then kind of show the research on it.
Okay, I'm gonna get off my soapbox now, Amanda, but I wanted to make that point as we were
That's a good one.
As we were going through it. Okay. Let me see. Where are we at now? I think we've done a lot of good ground coverage here. What are we missing so far? Anything that comes to your mind that you really wanted to discuss that maybe I haven't?
No, the big thing is, like, if you are recognizing that you are peeing your pants or having pressure down there or dealing with some kind of pelvic pain, please see somebody. You can make changes to be pain-free, to be leak-free, to be pressure-free. You just have to make the right choice to make the change. Can change your consistency.
If you're somebody right now that is resonating with Amanda's message, I want you to go to Empower Your Pelvis on Instagram, shoot her a message, tell her that you need her help, that she's available to work with you. And I would love nothing more if you would do that, because then you can come in the gym and we can go hit those PRs, and you can do so in a very safe and effective way. And I have a lot of respect for what you do. I'm proud of you for putting out into the world a body of information that wasn't really covered by many people, you know, and it's such a foundational part to what we do that it's a very noble thing that you're pursuing, and we appreciate you today.
I'm grateful to be here.
Yeah. Burn on Demand. Give me a little pitch for those listening. They can reach out to you on Instagram, or they can go to your Burn on Demand content if they are a Burn on Demand member. Yeah,
absolutely. Yep. Core and Pelvic Floor, and then even the Motherhood series on the postpartum. Definitely check out the core and conditioning days on there.
Okay. All right.
Yep.
All right. Cool. Thanks for your time. I appreciate you. Thanks for being here. All right, everybody, subscribe to YouTube or Apple or Spotify, wherever you're at. I just want you to know that there's another episode coming out. In fact, there's 2 episodes every week coming out, and we are so excited to be able to be this consistent for you here in the studio. Our team is dialed in. We're doing a great job. What we really want to do is bring you information that can make your life better, and we hope that you walked away from this conversation knowing more about your core, your pelvic floor, and how to reach peak performance in the gym. We'll take it out like we always do. 2 claps on 2. 1, 2.